Hey, welcome back everybody to another episode of Ask Dr. Jason with me, Dr. Jason Schweitz from Trinity Chiropractic in Maplewood. And so today we're going to answer a question that one of my patients, Tom, had asked us. Tom came into the office the other day and he noticed one of our therapies that we have all of our patients use before they get an adjustment, a therapy that we use to actually warm up your spine. And so the one thing that I love about when a new patient comes into Trinity Chiropractic, into the office here, a lot of people come through the door and they may have been a chiropractic patient in another office at one point in their life, or this might be the first time ever they've ever gone into a chiropractic office. But the one thing that I love about my office that most other offices don't have is that we have some unusual looking therapies that nobody has ever seen before, that I get the opportunity to explain why we use them, explain why we use them and the benefits. And then when people understand it, they actually love these therapies. They really make a huge difference in the office. So in the office here, we use therapies that I refer to as active therapies. And the difference there is that when you're talking about a therapy, it can be active or it might be passive. Now, active is actually something that you are doing to yourself. It requires you to move, bend, or twist and use your muscles, versus something that is passive, which means it's being done to you and you don't have to do anything. So an example of a passive therapy would be like an electrical muscle stimulation. Now, if you've ever had that done before, you know that there's these little pads and they put them somewhere on your back or your neck, and then they connect that to an outlet on the wall and use electricity to actively fatigue your muscles out. So that's something being done to you. Another example of a passive therapy would be an ultrasound. You might have had that done before if you've ever sprained or strained something. You know, they put a little bit of gel on you and they rub a wand on you for about 5 or 10 minutes. Again, that's a passive therapy. Another example of a passive therapy would be something like mechanical traction. So if you've ever been hooked into a traction unit that stretches your spine, you know, I know they use those things for your neck, for cervical spine, and they also do them for your lumbar spine. But again, that's a passive therapy. You don't do anything, the machine does all the work for you. And so when people walk into the office, we explain the benefits of using active therapy, and that's why we get better results here at Trinity. And so one of the active therapies we use is the cervical traction, which I had covered before in an Ask Dr. Jason. But today, the question was, one of my patients, Tom, came in and he asked, what are those blue balls that are sitting on top of the chairs in front of the TV? What are those things? Why do you guys use those? And so, Tom, thank you very much for asking us that question. And so today we're going to talk about what we call a wobble cushion or a wobble seat. And so patients can purchase these in the office here and take them home to do their exercises. And so when you purchase them, it's going to come in a little plastic bag like this. It's got a needle in there. You're going to need like a hand pump, something that you would pump up, you know, maybe like a basketball or football, and put the needle in it. So it's pretty flat when you get it. So when you take it out of the package, we'd recommend, you know, putting about 10, 15, maybe 20 pumps of air into it so that you inflate it, okay? Now the final product of that, it should look a lot like this one, and I don't know if you can see that difference, but there's actually a good amount of air in here now. So you want it to be inflated. And so what you're going to do is when you get your wobble cushion inflated, you're going to sit it down on top of a seat like this. Now the wobble cushion exercise, it's very important. Your spine has about 6 primary motions it can do, right? We can flex forward, we can extend backward, we can rotate to our right, we can rotate to our left, and we can also laterally flex to the right, and we can laterally flex to the left. And so those 6 primary motions are what we want to encourage patients to go through on a wobble cushion. And so just by doing this exercise, it's not only going to help loosen up your muscles and your ligaments that not only go along the spine, but surround the spine as well. The really cool thing about this is that, you know, when we get older, we lose blood supply to our discs, and discs after puberty roughly is when they can start to degenerate or atrophy. And so just by doing this, it actually helps increase your discs to stay healthy. It helps pump waste out of the discs and bring water back into the disc to keep it very healthy. And so what we recommend here at Trinity Chiropractic is to put the wobble chair or the wobble cushion on top of a chair, and we recommend sitting backward on the chair. And so what happens is that when you sit on this and your legs are straddling the chair, this is forcing your hip bones to open up a little bit, and that's what we want. Also, when you sit backwards on a chair, this is going to force your body to sit up primary more straight rather than getting a slouch of any kind. And so, really simply, I'm going to walk you through these ranges of motion that we do, and the first one would be just doing what we call spinal twists. And so what we recommend is patients, they should bring their hands up right in front of them, just like I've got going on, and they're going to twist to the right and left, and we recommend going slowly for the first couple. So you just rotate one way, rotate back the other way, couple slow ones here at first to actually loosen up the spine a little bit. Once we do a couple slow ones, then we're going to move into a faster pace, and we're going to do about 15 to 20 at a faster pace. So if you watch me, we go just like this, back and forth for about 15. So that covers our rotations. Next, we're going to get into some front to back bending. And so it's very simple with this one. You're going to tuck the chin to your chest and kind of hunch your back over, and then we're going to extend up, looking up to the ceiling, and then extending the back. So I'm going to turn sideways for this one so you can see it. But what we're going to do here is, so sitting like this, you're going to tuck your chin, really roll your back, and then you're going to come back up, stick your stomach out, looking up to the ceiling, and we're going to do that for about 10 to 15. So it's down and up and down and up, just like that. And then the last range of motion that we're going to encourage is lateral flexion. And so from this, I recommend patients having their hands up. Really helps with the range of motion, but we're going to tip over right to left, back and forth, just like this. Now, with that last one, with the lateral flexion, again, this is where having x-rays taken and understanding of scoliosis and how they work is very, very important, because we want to make sure we're not bending into a scoliosis curve and making things worse. Now, some people that have scoliosis, number one, they're not even aware of it, but number two, they're not really aware of how they should be exercising. So, for instance, if you have a scoliosis and you're bending into it, maybe you're at the gym doing exercises or going to yoga class, you may be making things worse. And so my patients are taught there's certain exercises they should be doing, and there's other ones they have to stay away from. They should not be doing at all. And so again, that's what we look for in the office, is we want to educate people how to make things better for them, not make them worse. And so again, Tom, thank you so much for asking the question, what is this blue ball sitting on top of the chair? Again, that's a wobble cushion. One activity that patients do in the office, but we also recommend them doing at home. Again, this is just something that helps us get better results here in the office with all of our patients. So we look forward to doing an Ask Dr. Jason next week as well. Please leave a question on our, either email us, Facebook us, or you can even leave one on the YouTube channel as well, and we'll answer it. Thank you.